Good afternoon once again to all our faculty and student members. Thank you for joining for the afternoon session. The title is A Motivational Session by Successful Innovators. Often when we take a long journey, at times, we find ourselves having lost track of our destination or our goal in life. It is in times like this that a small ray of light at the end of a dark tunnel shows us the way to reach our final destination or our goal. During the pandemic period, many careers were affected, including that of dentistry. Some minds among us came up with new innovative ideas that has led to propelling the field of dentistry forward. With this, I would like to invite and welcome our speaker for today, Dr. Vinay Sundar sir. Sir holds many feathers in his cap. A few in his specialities are oral oncology and reconstructive surgery, oral facial pain management, sleep medication, and many more as such. Not only does Sir belong to the field of dentistry, but also is a in the sports field, has taken part in many marathons, cycling, and swimming championships. Sir also has a sweet tooth that Sir shares with his better half. We are pleased to welcome you, Sir, on this platform and kindly request you to take over and present the session.
Thank you, Dr. Annam. I would like to thank the HOD, Dr. Daya, for giving me an opportunity. I hope I'm audible. Is my screen visible? Is my screen visible? Am I audible? Can I get some response?
Please? Yes, sir. Yes, sir. You're audible and you're visible. Thank you. Please continue.
Okay. So when I used to be a UG student, whenever some speaker used to come and present, the first thing I used to look at was the number of slides they have. So I'm sure most of you must have that query with you. I'm not going to take more than 35 slides, and most of it contains only pictures so that you can have more amount of attention. So that is me, Dr. Vinay. So I'm a surgical oral oncologist and a reconstructive surgeon, and I have finished my fellowship in orofacial pain, sleep medicine, and temporomandibular joint disorders. Currently member of the Royal College of Surgeons in Ireland and Glasgow. I just want to give you a brief intro about what all happened from my journey from my first year BS until where I am today. So by any chance, does anyone have an idea of who the person depicted in this picture is? I am sure even I didn't have any idea until yesterday. I had to Google this guy. Apparently, he is Mr. Tyson Gate. So until Usain Bolt came into the picture, he had the world record for the fastest 100 meter sprints, right? And one Usain Bolt in the picture, he's all over the media. And, of course, he has been training himself for quite some time and all that. Now, what exactly I'm trying to tell here is, even though Tyson Gay is not known to people anymore, he has had a wonderful and successful career. So for the first years, especially, and almost all the budding dentists here, dental is always not the first choice for all of us, most of us, including me. Always wanted to do an MBBS, and then we didn't get it, so we joined here, right? So why is that always a second choice? Of course, there are people who take dental as the first choice. So let's go into it one by one. So I'm going to take a small, nostalgic trip. So I finished my 12th grade, and the marks were not sufficient for an MBBS seat. So I went to Delhi for preparation. But before that, I did get admission into Sri Ramchandra College for a dental seat. But I was quite clear that I want only MBBS and I won't take up that. So I went to Delhi, prepared for a year, very narrowly missed, and ended up being in the same college again next year. So it's somewhere like Ollivander says in Harry Potter, right? I didn't choose BDS, BDS chose me. So, but anyway, I have no regrets today. And I'm in a happy place today. So the one on the left is one of the recent neck dissections we performed. So neck dissections are performed especially by oncosurgeons. You need to have a PG in maxillofacial surgery. And the right is my clinic. And any day happy to be called as a dentist. Although I'm a maxillofacial surgeon, there is some stigma to some of the people calling themselves as a dentist. I'm any day happy to be a dentist as well as a maxillofacial surgeon. I always wanted to be in the OT right from my kid. And today I'm happily there and no regrets for taking BDS. Now, Why do we always think the dental is the second choice, right? We always put the blame on the society, and almost most of our cousins and relatives who are not there, they think it's only about the teeth. You're not even a real doctor. You cannot save lives, and there's a lot of competition. The moment I joined BDS, all the relatives told me was there are a lot of dental clinics almost in every street. It's going to be very difficult to survive and all that. So I had no clue as to how to respond either because I had just joined the course and all that. So is it the society which is responsible for it? Definitely not. The only people who are responsible are we, the dentists, ourselves. So we tend to put ourselves down because we are not confident enough, to respond to calls made by MBBS colleagues and all that. So again, there's a famous scene from The Hangover where they check into a hotel room and one of the friends of the dentist says, "Do not call him in case of an emergency because he's just a dentist." It almost is just taken for fun, but it's taken for granted that dentists do not know much about the medical emergencies and stuff like that. So simple scenario here is, so when someone asks who's the current captain of the India, right? Current captain of the Indian team. So the ongoing New Zealand series, it's Shikhar Dhawan, and recently it was Rohit Sharma during the World Cup. So there is such an enormous amount of talent in the Indian cricket team that they are able to send three different teams with three different captains, right? So each one is having their own time, and of course, only the popularity is different from success, right? You can be successful in life, but you need not be popular. And the other way around is also true. You can be popular, but you need not necessarily be successful here. The one perfect example was the Murli Vijay. I'm sure most of you must be knowing. I'm giving cricket analogies. So he captained an IPL team, which is the Kings 11 Punjab. He's a part of the winning team since in CSK. He's represented India and performed well in tests and a consistent domestic cricketer. Not many know about him as or discuss about him as much as that of Dhawan or Rohit. But at the end of the day, he's also been successful. Just that he's not being talked about anymore, but he's living a quiet life. He has his own golf clubs, playing shuttle and all that. So what parents and students need to know before joining BDS? First of all, it is not an easy alternative for MBBS. I've seen many parents personally, ask kids to join BDS because they just get a doctorate degree next to the name. And it is not an easy alternative for 5 years. It is not only about the teeth. It's about surgery, medicine, art, and a lot of handwork. I was not good at my handwork, but I realized it needed a lot of handwork. It takes time to settle down. The moment you take bio in your 11th grade, the first thing which people tell you is it's going to take time to settle down. So be mentally prepared that this is a wonderful profession, but it is going to take time to settle down. Settle down meaning financial independence. Life is good as a dentist. Trust me on this. It's going to take time, but life is good. Keep developing your skills. As far as competition is concerned, there is competition everywhere. There are e-shops, there are malls, there are cinema theaters, and everywhere something keeps new popping up. New restaurants keep popping up. But if you're good at your work, if your content is good, if your quality is good, so you're going to have your own set of patients. Now, how different is BDS? Now, say someone has just finished their MBBS, okay, and they want to set up a clinic, right? So what will be the maximum set of investment? They would require a table, will probably require a stethoscope and a few set of minimal instruments and some medications and one assistant or something like that, right? This is not entirely different in BDS. The degree is surgically oriented. That way, it is Bachelor of Dental Surgery. Of course, we do treat with medicine, but you have to do a procedure to intervene in any point. For example, say a patient walks into your practice or even calls you saying there is pain. You can prescribe a medication if he's overcalled, but you definitely want the patient to come to your clinic or intervene something. It could be a simple examination. You can't examine a patient virtually, right? For example, he has a TMJ issue, you need to palpate. If he has a trismus issue, you need to palpate. Even if he has a lesion, you need to palpate. So dental is entirely different from medicine. I'm not saying we are superior, we are inferior. Ours is different and ours requires time and ours requires a setup. So simple prophylaxis restrictions. I'm sure most of you would have seen patients where they have a pain for quite some time. It's just a simple food impaction of between teeth, right? So you just do a prophylaxis and they are fine, absolutely. So you can't do without any kind of intervention in dentistry. And you need a solid investment compared to the medical setup where you want to become, a simple physician, right? You need a chair and a minimum setup costs about 5 lakhs. I want to talk about very basic setup. It's going to cost you approximately around 5 lakhs. You need to keep all this in mind before joining BDS. Right? You shouldn't know like, oh, I didn't know about this. No, you should have known that dental is going to take time. And if you know about all this, the number of people joining dental will be relatively less because people who genuinely want to practice only takes dental. Random people joining and not utilizing the degree also increases the number of dentists. So as I said earlier, video consultation can identify the only problem to expense and job issues. Yes, If you finish your MBBS, you're given jobs as medical officers. You can even work in an insurance company where you have to sanction, see the X-rays, and allot insurance to the patients. Such options are not available in registries in India currently. I am still clueless as to why insurance companies haven't been able to develop a good amount of investment for the dental. I don't know exactly. I did try asking a few companies. They said like something like ours is more of a cosmetics. For example, even if someone has to correct their middle and diastema, it comes under cosmetic and not under functional. So, but all over the world, you have insurance companies. So I don't think that is a valid reason as to why insurance companies shouldn't come to India. So this is one other degree which I recently did from the USA. It's orofacial pain, sleep medicine, and temporomandibular disorders. This degree is exclusively done only by dentists. So once you finish your BDS, you can take up this degree. So currently in the US, this is very popular and very an establishing field. It's well established in the US. Yes, they have just introduced this in India, and first batch has finished the master's degree. We are the second batch here, and I'm going to compare this to how implants were in the year 2000s, right? Implants were just coming in the year 2000, and today you can see how popular implants are. So this is one of the best degrees you have to consider after your dental, and it's going to pay you not immediately, but again after 10 to 15 years when it becomes established, and by the time you'll be a pioneer in this. So my guide here, Dr. Davis Thomas, so we are asked to present cases here, sometimes remotely through video call. And suppose the patient is in another town or city, and can I tell sir, like, sir, the patient is in a city and I'm in my clinic, is it okay to present my last? He says no. He wants the patient in my clinic. As I mentioned earlier, you need to have a setup. You need to examine the patient. You cannot give much of help through video consultation. Of course, small things can be done through video consultations, but dental is mostly about procedures, any form of dental treatments. What's next after BDS? Well, this is a question which has been running almost in everyone's mind ever since you took up the degree or probably during your internship. MDS is the first option, obviously. Clinic and practice. Yes, you can set up a clinic with your BDS and be practice. Academics, you can work as one of the lecturers in one of the colleges here, or with your postgraduate degree, you can become a visiting consultant. Tie up with corporates, you get job opportunities, or you can start your own YouTube channel. There are a lot of YouTube channels which talk about dental chapters and all that. Of course, if your content is good, you will get your own subscribers and your own set of people watching the videos. So there's one other option you can do after BDS. There are a lot of courses. Suppose you say, I do not want to do MDS, I cannot study for another 3 years and all. There are courses which help you to do RCT. They help you to do a lot of courses for RCT courses are there, and restoration implant courses are also there. But a general request from my side, I see everyone has their own opinion, but request from my side is like, if you're not doing an MDS, you can do the courses, but make sure you practice only in your clinic. You're not allowed to go as a visiting consultant with your short-term courses. Short-term courses are for you to practice in your clinic, not as a visiting consultant in any other clinic. Of course, fellowships are there. I've finished my fellowship in oncology. So once you finish your master's in maxillofacial surgery, the other options apart from oncology are microvascular reconstruction. Then you have orthognathic surgery, which means, repositioning of the jaws. Then you have cleft lip and palate. You have hair transplant. You have whatever other aesthetic courses also. And the DCA has made it very clear that maxillofacial surgeons can do it. You need to be a maxillofacial surgeon in order to do an aesthetic course here. So make sure you chart out what you want. And of course, you can do a PhD with just your BDS also, in case you're very much into research. There are a lot of options here. Now, what's next after BDS? These are my YouTube channel. It's about what are the various options you can do after BDS. I've discussed with all my friends and colleagues who are in different parts of the world. So you can check out this channel. And suppose you want to go to abroad, what is the process, how to prepare for the exams, and everything is there. And these are my contact details. This is my Instagram channel. You can always mail it to me, and this is my number. Anytime you can reach me out if you want any help in, deciding about your career plans. Now, do all branches have scope? There is this popular page in Facebook called as the BDS Confessions, where I've always seen people put down non-clinical departments saying you don't have much of scope and only the clinics have a lot of scope. Don't invest your money on non-clinical departments. And this is all humbug, absolute nonsense here. I'm going to tell you briefly about what each specialty can do after their post-graduation. Okay, let's start with oral medicine. And these are the books I studied from. So oral medicine, okay, first is like you're going to become a proper clinician, right? So you need a chair to practice. There are some times where I refer cases to my colleague because I'm not able to, exactly tell what exactly the lesion is. Of course, OFP course has helped me a lot now. And you can set up your own center, with the radiology, CBCT center, CT center, and all that. Pediatric dentistry, needless to say, you're going to become a kid specialist, and obviously you tend to learn all the procedures, and along with dentistry you need to learn a lot of psychology and counseling also, because it's not any patient on the dental chair has anxiety, and as a kid you can imagine how much of anxiety he have. Perio, needless to say, amazing gingival surgeries, flap surgeries, and implants. You can do a lot of other stuff. Endo, needless to say, again, root canal treatment and all that. And you have prosto. Actually, I have a lot of funny stuff to say with prosto, because I like prosto a lot, but prosto didn't like me. In fact, in my second year during the teeth setting exam, I still remember after my university exams, my lecturer called me and said, I literally had to fight with the examiner to push you through. You had got only 49 and all that. I tried my best to love prosto, but I didn't get the reciprocation from the same. Ortho, amazing. You have Invisalign braces, a lot of, you can become a part of planning the orthognathic surgeries. Public health dentistry, a lot of people ask me, is there anyone use? I'm sorry, there's amazing, amazing, amazing branches in public health dentistry. First of all, you get to socialize, understand how people think about dentistry. You guys can play a huge role in approaching how the patients approach dentists, how tell them how dental care is very important and all that. You can become a part of the World Health Organizations. A lot of awareness campus, social campaigning can done with the public health dentistry. You can get to travel around the world if you know how to move the right cons. And again, max fax or oral pathology, right? So many people again ask me the same question: is it even any use? I'm sorry. When you're doing oral cancer surgery, right? We almost have a pathology coming for every case, because they are the ones who tell if whatever we have cut, right? So say the size of the cancer is 2 centimeters, we need to cut it 3-dimensionally with a margin of 2 centimeters. Sorry, the margins will be 2 centimeters. So it's the pathologist who grosses that with the microscope and tell, yes, the margins are clear, you can proceed. It's amazing pathology. So don't ever let anyone tell that this is not good, that is not good. It is going to take your time, and you need to figure out as to how you have to go away. And the last, of course, my specialty, oral and maxillofacial surgery. I was very deeply in love with the moment I came to know about this. So no regrets, no, I'm very happy. And you have a lot of options here. You can become an orthognathic surgeon where, jaws and other, you do trauma, hair transplant, cancer surgeries, reconstructive surgeries, microvascular surgeries. Microvascular means where you take, what do you say, graft or a free flap from another part of the body. And under the microscope, you're going to connect with the arteries and the veins so that the flap becomes vital. This is microvascular reconstruction. So consider all the options, see where you have interest, and all of them have equal amount of scope. You just need to be patient and establish yourself. It's going to take time though. As far as abroad is concerned, let me make it very clear. If you are in the 12th grade, or I don't know if 12 people are watching here, if you have plans of going abroad, move there immediately after your 12th. If you're going to finish your BDS and then go, it's going to become very tedious and very expensive. For example, in Australia, US and UK, they want their respective license exams to be cleared. So only if you clear their license exam. As far as Canada is also considered the same.
Sorry for the disturbance.
Yeah, no problem. So moving on, see, life is good in India. India is good. See, but before the pandemic, we had people thronging theaters. Now people want only OTT. They say, will the theaters be shut down? Absolutely not. There will be people who want to go to theaters. There'll be people who want to watch an OTT. Not all movies will be watched in theaters. Not all movies will be watched in OTT. There are people who visit both a local tea stall as well as something like Chai Kings, or you would love to have a dinner in ITC or even the roadside shops, right? So the crux of the message is like, if the content is good, you will have your own crowd. But to make sure your content is good, you need to have consistency and quality, which comes only with time. You can't get it overnight. So clinic management, yes. I had set up my clinic in the month of 2020 January, if I'm not right, and we had the lockdown in March. So within the first 2 months, we had a lockdown. So we were quite worried actually what to do and all stuff like that. Fortunately, as luck would have it, what exactly happened was Practitioners who were above 50, right, 50 years and above, they had stopped practicing and were absolutely not willing to come out at any point of time. And since they, few patients who even stayed, my clinic is in Mylapore, so the patients who stayed slightly far away from Mylapore also were willing to come because they wanted to get their dental treatments. So lockdown was both a boon as well as a bane, as I mentioned earlier. So, and some people want to have a posh clinic, some people want to have a basic setup. Trust me, it doesn't make a difference, right? It's all about the investment you have, right? You can start with a small setup and always expand yourself, make it a 2-chair practice or a 3-chair practice, or have good amount of clientele. It's going to take time though. That you can't compare saying like the other person had more money or something like that. If you're good, you will have your patient. It is going to take time. There are days where we haven't had patients for weeks together, but just go sit in your clinic, keep reading something. Always, update yourself, see what is the latest technique in the market. What else can I do to improve my patient quality of life of my patient? Something you can do. Another example which I wanted to tell you is like, for example, you want to bring your mother or you yourself want to get an dental treatment done. So will you choose someone like me who's just 7 years old in practice, or you want to go for an established practice? Obviously, you want to go for an established practitioner, right? Now, yeah. So you will have to take your own time. Now I'm in the field for 7 years. So I have a certain amount. The initial referrals to your clinic will be only from your friends and relatives who are coming. And of course, there will be some walk-ins here and there. So make sure you spend good time with the patient, examine, tell them what they want. And despite the age of social media, trust me, it's only the word of mouth which brings you more patients. Social media account, yes, you might have a lot of followers, you might become very popular and all that, but it's got absolutely nothing to do with your patient flow. Your patient flow and your social media account is totally insignificant, at least according to me. Yeah, I was talking about this page only, the various confessions page. It's a quite interesting page, actually. I follow it, and there are a lot of people asking a lot of doubts about this, whether to do BDS or not, whether I do MDDS or not, what can I do for this. Do follow this page. Some of the advice are amazing, some of the advice are stupid, but you need to know how to filter it out, right? So patience is the key. You have to sit in your clinic. Whenever the patient will suddenly walk in, you have to be there and be available. So make sure if you open a clinic, you are there all the time. You need an assistant also, but make sure you're always there. Referrals, go visit your adjacent medical physicians, tell them you have opened a dental clinic. And it takes a time, Lawrence. It might, so for example, it might be an established practitioner sitting next to you. He might not be very, comfortable in sending a patient to you. So he might refer one patient, and if they give a positive feedback, he's just going to change the title and going to send all the patients to you. Be patient, be patient. Do an ethical marketing. When I say ethical marketing, you need to market yourselves. I'll give you a good example. See, all of us know Pepsi is bad, right? All of us know Pepsi is bad. But some point of time, we would like to drink Pepsi, right? So even if we don't discuss about Pepsi ads keep coming every day. That is the amount of marketing they do. That's the amount of every day. Even if you take Pepsi once in a year or something like that, you need to put in people's mind that you exist. So do some marketing and make sure some awareness posts or do something like that. Do ethical kind of marketing. And when I say ethical here, please understand, do not give discounts for this is not some sale which is going on here. Your setup price, make sure explain to the patient why it costs so much. If they ask you for a discount, say, sorry, sir, we do not do this. This is another reason why many people suffer, right? For example, you say you're going for 2,000 and your colleague says, don't worry, I'll give you 500 off, right? You're compromising on it. One of my colleagues faced this issue. He used to be a consultant in my clinic. He said I started giving discounts, and everywhere he referred patients, he said that keep pestering him, he'll give discounts. At one point of time, he got to be known as a discount doctor, and it was very bad for him. So he had to take a lot of effort to come out of that name of discount doctor. So as you said, you'll have 0 days. There'll be some days with absolutely no clinic. Do not feel bad. Your clinic is like a baby, right? The way you take care of it, it's going to take care of you someday. Spend time with the patients. An assistant is mandatory. Yeah, that also should keep in mind with the investment. No discounts. As I told you, remove that word, no discounts. You can clearly mention it. There is a board in my clinic which says, kindly ask for the prices before you start your procedure. We are very clear that we will mention the price of the procedure, and you have to respect the patient's choice. The patient wants to get the procedure done under you, get it done. If you're not, you always have every right to move to another clinic. Do not worry that you are losing a patient. You are worth that much amount. So don't put yourself down. Don't undercharge and always be in the clinic. So what basically I'm trying to tell here is like, it is not easy, but it is going to be an interesting journey. It's going to take your time and spend some good amount of time in the clinic. Is MDS mandatory? Okay. First question is like, many people have told me they do not have the finances to do an additional degree for another 3 years. Sensible enough. But if you take the NEET exam, the total number of government colleges in India is not even about 150, if I'm not wrong. It's only about 150 government colleges here. So if you need a rank with a subject of your choice, you should be somewhere on less than 100 something. So anything, even if you get a rank of 200, which means you're prepared well for the entrance exam, is not going to be sufficient for the course you wanted. So entrance exam, yes, keep trying and all that. But there are BDS clinics who are doing well. But what exactly I'm trying to say is, suppose you're just finishing your BDS and starting your clinic, right? Make sure you call the consultants for the respective procedures. Over a period of time, you can learn from them and start doing them by yourself. Do not create a mess and then call the consultant. Recently, I'd been to a clinic for an impaction procedure where they had attempted a 3-8. There was a mess all over. I couldn't say anything to the patient, neither could I say anything to the doctor, because my job was to remove the tooth. But I just put a word to the doctor saying, please respect the patient. If it had been your mother or father, I'm sure you wouldn't have done this, right? If I don't do fillings in my clinic, I don't do root canal in my clinic. Although I've been trained, I feel there are specialists who can do better jobs than me. So let the specialist handle this. Procedure is comfortable, and the patient is also happy at the end of the day, and they know how to manage the complications better than you. So if you do not know something, be bold and say, no, I don't know, and let the experts take in. You can't do everything. And patient comfort is the topmost priority. See, when a patient comes to your clinic, when he goes back, he should be happy with whatever procedure has been done to him, right? So make sure that is given topmost priority. Money will come slowly. Don't worry, money will come. And although there have been a lot of discouragement regarding dentistry, I personally do not know any dentist who has been practicing for 10 years and is saying, I have not earned money. It's going to take time. How do I decide the cost of my procedure? Like I said, as far as dental is concerned, you have to use a separate instrument. For example, if I use a mouth mirror, I can't use the same mouth mirror, right? So you have to wash it, sterilize it, pouch it. Then you need an autoclave, you get electricity. And how complex is the procedure? Is it a simple extraction, or is it transorder? Does it require implant? And of course, your skill that you have to decide how much you are worth it, the amount of knowledge you have, and the follow-up and the ambience to a certain extent, right? So, for example, some people say like, I charge this much because it's an AC clinic. Some people say I charge this much because it doesn't have an AC. End of the day, those things are under your control, but make sure you do not undercharge. There's a lot of difference between dental and you can simply realize like so much of effort is there in planning for a dental procedure here. Additional training. So suppose you are not able to pursue any master degree, work in a clinic under someone who's an experience, say like 25 to 30 years. First of all, you know clinic management, how they manage various patients, how they manage various consultants. You can earn the money, utilize in your PG, or you can learn particular technique and then set up your own practice, right? Learn the skill, but practice only in your clinic. This is just a simple token of respect for people who have done PG, who are allowed to go as visiting conferences. And MDS and non-clinical is absolutely a good choice, provided you have interest in it. Do not put down saying this field is better. There's no such field where this is the better field or best field and all that. It's going to take time, but every field has its own scope. You need to create it, especially in oral med, oral path, and public health industry. I've told us what all you can do, in each of these specialties. Patients for patients. Yes. So sit in your clinic, open your clinic, read something, or sometimes you can watch a movie also. It's entirely up to you, but make sure you are in the clinic, have the instruments ready, just document. Even if it's a single patient, you feel very happy, right? At one point of time, I'm sure, trust me on this, there'll be time when you don't even have free time in your clinic. You'll be very busy. So I'm almost going to complete about 4 years of my practice. And it's going to take 5 years to be financially independent. Yes, I'm not financially independent completely. We are getting good amount of money in my clinic, but the expenses are equally good. The rent, the salary of the assistant doctors, electricians, the teams. So it's going to take another 1 year, but we are happy with whatever we are doing currently. And the patients who have come to our clinic are also happy. Next, Royal College of Surgeons is one of the journeys which I discovered during the lockdown. So I'm sure most of you would have heard like any cinema dialogue also they say, right? Or when the London FRCS and all that, right? So FRCS stands for Fellow of the Royal College of Surgeons. That is a degree for the MBBS people. If it is dental, it's FFDRCS, Fellow in the Faculty of Dentistry, Royal College of Surgeons. As far as Royal College of Surgeons are concerned, there are four, as far as I know: Ireland, Edinburgh, London, and Glasgow. There are about four. So each one has the highest standard of care and practices. So you need to clear the exams to become a member. So I had cleared the Ireland and the Glasgow exam during my lockdown. Of course, I had some good amount of time to study them during the lockdown, relatively free. So we are providing study materials and a test series to clear these exams. These exams are very, very prestigious. And once you become a member, you can write the another exam, the specialty exams. You get the FFDRCS. It's very prestigious. And trust me, you get a lot of job opportunities in the Gulf with your FFDRCS. And even there are a lot of other things also, which I've discussed more in my channel. But you can always feel free to mail and ask me anytime also. So it was very good, and I had these both in my hands. So one is from the Ireland, the other is from the Glasgow, and we have an academy. And feel free to approach at any time. We're providing your access to all your foreign exams, be it DDS, ORE, or Canadian exam, and everything. You're working on that. So, but you can always approach us. We have all the study materials and always be happy to guide you. Teach. Now, as a first year or someone who's in a final year, or suppose you're trying to learn a concept, right? So make sure you're able to simplify the concept and imagine or explain the concept to a school kid, right? So if you want to simplify a concept, you need to read it repeatedly, understand, and then such a way that you'll never forget. For example, let me give you a simple analogy. Suppose there's a house, a mouse enters, then what do? You hit the mouse, you kill it off, right? Suppose 10 mouses enter and they have crossed the hall, they've gone into the bedroom, right? Then is that something which has be more radical have to be done, right? That is how cancer spreads also. It may be a very, not a proper analogy, but something you have to understand the concept. So the cancer, if it's in T1 and T2 stage, it can be treated as soon as possible. If you get a neck node, your survival rate comes down by 50% and all that, right? So make sure you read the concepts on something like that. See, everything can be simplified. Everything can be simplified. It's going to take time. So enjoy whatever you read. Then try to imagine you're teaching it to a kid, like say, see, this is what happens, this is what happens, this is what happens. You understand the concept better. Spend some time. I'm sure you'll never forget this also. And NEET entrance preparation, as far as when I was preparing for PG, it was not NEET, it was AI, PG and all that. There's this Tamil Nadu Dr. Medical University, it's in Gindi there. You need to go there sometime because what exactly happens is, suppose you do not study, like you go there in the morning 7 and be there until 10 o'clock. Suppose you lift your face up, you'll be seeing somebody else who's also studying. It instills some fear in you, like, okay, there's somebody else who's preparing for the exam. And then you can discuss with them questions and all that. It was a wonderful time sitting there, and I learned a lot from there. And it helped me a lot also during my entrance preparation. And now you have your CDs also in Davangiri. There is also another reason. You need a group to study, but make sure the group is motivated and not, wasting your time or something like that. Fear is good. Fear is actually good sometimes. Social media relationships. Okay, I am quite active in social media, but do not take it seriously. The counts hardly matter. Whether you have likes or followers or subscribers, doesn't matter at all. Just post something, be happy and come on. Don't discuss too much about it, or don't discuss too much about others' lives. See what you can do from move forward. Always document what you are going to do for yourself that day. What did I do today? Okay, make sure, and the current generation, previous students I've seen when I was teaching a couple of years ago, so they skip breakfast. They directly finish their theory classes at 10 o'clock. They eat one samosa and Pepsi. You're literally abusing your digestive system like anything. Literally abusing your digestive system like anything. Breakfast is mandatory. Sleep is mandatory. Make sure you don't use your phones constantly. Always, it's good to be on the phone, but you can't continuously use. Make sure sleep is not disturbed. Your priority should be a career. It's nice to be in a relationship. I was in a relationship with my senior, and she ended up being my wife. Happy about it. We were quite focused on our careers. We're very focused. We didn't disturb each other during a piece. Of course, we met and all that, but priority should be your career. That would help you in the future. Not going to spend time with each other now and all. You want to compromise your career. Trust me on this. Life goals. So plan your life, short-term goals, medium-term goals, long-term goals. Short-term goals could be something for this week. Okay, I have to finish this subject. Okay, I have to finish this chapter. And when you're reading something, there should be absolutely no form of disturbance. Put off your phones. Make sure you tell your moms also, don't come in for asking me whether I should eat food or something like that. Just read for 1 hour a day. It makes a huge difference. Then medium-term goals, like what I should do for the next 1 month. Suppose you have failed in one of your internals or something like that. Make sure the second short-term goal for a medium-term goal should be like, I should prepare for the exam. Let's leave about passing or getting good marks. If the second internal, if your goal is like, let's prepare for the exam, the final internal goal is you should like getting good marks or something. Document your seeds. When I say seed, what I mean is like, suppose you have like about a lot of goals, right? Document it. Like, okay, today I want to lose. So suppose I want to focus on losing weight or something. Okay, document what I did for that today. Every day document something. What I did for this today. What I did for this today. These seeds will one day grow into huge trees and you'll be very happy about it. But you need to be consistent and plan appropriately. Please, proud to be a dentist. I'm a maxillofacial surgeon and I always call myself, yes, I am a dentist and I'm absolutely proud about it. Even though people say it's just about teeth, you do not know the same lines, I'm very sorry. Medical emergencies, not almost, all dentists know how to handle a medical emergency in the dental chair, right? All of us are trained that way. So literally we know very well. It's about just that we don't discuss with our medical colleagues. For example, say someone's fallen down in aeroplane or something like that. This recently happened in one of the conferences, and one of the passengers had fainted and a dentist had done CPR and saved it, right? So a dentist is well trained in CPR. See, if you're going to rush the patient to an emergency, even a simple MBBS is not going to do anything. There's an emergency trained team which is going to do anything. Consultants who are going to do this, maybe anesthetists or something like that. You know what to do. That is good, right? So be proud about yourself. And dentists are great. See, we have such a small working area, right? The tooth is this much and all and something like that. And we put our entire face into another person's mouth. You know, the mouth is the most notorious when it comes to contamination, right? All possible bacteria there in the mouth. So respect yourself, respect your profession, and never put your other colleagues down. For example, if a patient comes to your clinic saying that I had gone to this clinic and the doctor didn't do a good job, do not be with him. Just saying that he has done his best. He'll come to me, I'll do my best. That's it. Never put other colleague down. That's very, very important. So this happened during the lockdown. My wife was pregnant. We didn't know what to do, and she was not allowed to go out. So we were casually experimenting. And at one point of time, we realized like we had every armamentarium, and we casually started a bake per page, and it worked out to an extent. And this is one of our hobby. We bake together. So I bake and she frosts. The other is cannot. Well, I cannot frost and she cannot bake. Is doing good today, and we are taking only limited orders because my first priority will be in the clinic and the hospital. So we have plans of opening an outlet, but not anytime soon. First, we need to focus on the dental aspect and then only come here. So I love traveling and I'm an adventure pro guy, something which not many people are comfortable with. So the picture on the left, there's a cycling which I did to Andhra, 225 kilometers. And my first full marathon, 42 kilometers in 2000, I think 18 or 17, I'm not sure. Third one was in Goa and the bungee in Nepal below. And the picture on the right top corner is when I finished my triathlon, where I had to swim, cycle, and run on the same day. So it was fantastic preparation, and I had a good time maintaining my physique. Currently, I'm not maintaining my physique. I'm trying to get back to it. I'm sure I'll do it one day. So this is my family. So my dad, mom, amazing. I'm nothing without them. So till they support me, right? They understand that it's going to take time for a doctor to settle down. So 35, I'm just 31 today, and it's going to take another 4 years for me to be financially independent. And they know it very well, and they are with me all the time. My wife, she's an endodontist, practices in my clinic, and she's also visiting consultant, part-time baker, an amazing mother. So it's good to, and she's also understanding like surgeons take even more time to settle down than regular doctors. So she only gives me pocket money actually these days. I don't get me. So this is my YouTube channel, and please subscribe, watch the videos. If you have any doubts, we are uploading more contents to the other countries also. We have covered so far about all the Royal College of Surgeons and US, UK, and what are the various opportunities you can do in India also. So Hope this session was useful, and never say it's the end. Always keep asking yourself what next. I hope it was useful, and now I'm open for doubts or any, what do you say, clarifications or something.
Yes, sir. Thank you so much, sir, for this very informative session. A few queries that have come across from our students are, is the DDS, that is the specific in the USA, is it accepted worldwide?
Okay. First of all, DDS is a degree which is done in the US, right?
Yes, sir.
So your investment was going to be somewhere around 1 crore. I'm not exaggerating. It's about 1 crore. My friend has finished and she's practicing in the US. Why would you want it to go elsewhere? If you want to go to the US, might as well practice in the US. Why do you want the degree to be recognized worldwide?
Okay, sir.
If you're going to US, be in the US.
All right. The next question is IELTS as and TOEFL, test of English as a language, needed for doing the public health dentistry programs that are done abroad?
MPH, Masters in Public Health. Yes,
Yes.
you need to do give either a GRE or a TOEFL. IELTS. I do not exactly remember, but they are given in detail in those videos.
Okay, sir.
You
I'll
can
ask them
check out
to
the video
refer to
with
that.
Dr. Maitreyi Rajagopalan. She did it from the UK. And one more MPH from Dr. Rohit Bal. Both of them have finished. Both of them, one is my junior, one is my batchmate. So they've all finished that.
And then the last question here, can a dentist with a foreign degree practice in India?
Question is the same to them. If you want to practice, see, it's the other way around, right?
There's dual, yes, sir, like a dual degree maybe. Like, can they practice in India as well as abroad?
I think you can practice India, not an issue. But my question is, why do you want? But of course, there is a clause there. UK, US, and Australia shouldn't be a problem here because their standards are accepted here. But other countries definitely not. But I'll still check with the DCI and probably let you know if that license is valid here for you to practice. I think it is valid. A few of them have done their masters and are practicing in India. It is valid. You can practice, but only in selected countries. And that is you need to finish your dental school from the selected countries and then come back here.
All right. Thank you so much, sir, for your valuable time and for
something from chat box.
Yes, I think someone has sent.
One line advice to a first year student who just joined the dental surgery. Okay, I'll tell you how much against dentistry I was. Of course, I joined Ramachandra. Ramachandra is a different culture. You feel good to go to college and all that. I wrote my entrance exam as I was preparing for my university exams, thinking like somehow I'll go to MBBS. I won't sit in BDS and all that. But obviously, when you're in dental school, you have to focus here, right? So one line advice would be, okay, I can't tell it in one line, sorry. I want to take a few lines. Focus. Dentistry is amazing. We have a lot of opportunities and there's nothing like dental. It's one of the best fields. Focus on your career, like focus on your studies. Spend good time with your friends also. That's equally important. Participate in culturals and all that. Focus on your career. Make sure just study 1 hour per day, man. It is more than enough. You study 1 hour per day, concentrated, that is more than enough. BDS degree in India is valid abroad. No, no BDS degree is valid anywhere in abroad, except Gulf, but you have to clear a license exam. US, you have to do the entire course again in the form of DDS. UK, you have to clear the ORE exam. Australia, you have to clear the ADC, Australian Dental Council exam. With your BDS, you can't start practicing abroad. No.
Okay, any more questions? Let's see the chat box. Like that. Okay. So I guess we can wrap up the session with this. Thank you so much, sir, for your valuable time and for the insights in your personal life and your practice. Wishing you.
Thank you, Annam, and thank you, Dr. Daya, for
Madam.
the opportunity.
Yes, and on behalf of Dr. Daya Madam, I take the privilege of presenting to the speaker their certificate of presentation.
Thank you. Thank you. All the best to everybody. Take life. It's very easy. Right? Take it, make it simple, and watch a lot of movies, play sports, do everything you want. But make sure you spend at least 1 hour per day for your studies. It's going to make a huge difference. That's it. Life is very easy. Thank you.
Kindly fill up the feedback forms that are provided at the end of the session. Just provide certificates.
In case you want to reach out to me always, I think most of you have taken the, just share the screen again.
Yes, sir.
Use my email ID. Yeah, this is my contact details, my email ID. This is my clinic number, but you can always message me. That is my Instagram page.
Thank you, sir. And I just present your certificate, sir.
Thank you.
Please accept this certificate from our institution and from Madam's side.
Thank you so much. It means a lot.
Sir.
Thank you so much.
Thank you, sir. Please fill up the link, the chat box with the link provided, and we will leave.